Welcome everyone. Thank you for joining us today. I'm Teresa Marantet, CEO and Chief Nursing Officer of the Windsor-Essex County Health Unit. Please continue to do your part to prevent the spread of COVID-19. Stay home if you are sick, maintain a 2-meter distance from others, wash your hands often with soap and water or use an alcohol-based hand sanitizer, use proper respiratory etiquette by coughing into a tissue or your sleeve, and wear a mask when you cannot maintain a 2-meter distance from others. For those of you who are voting today in Ward 7, the City has done a great job implementing public health measures to ensure your safety while you cast your vote. I will now report our current case counts. There are 166,156 confirmed cases of COVID-19 in Canada and 54,199 cases in Ontario. Chatham-Kent has 369 cases, and Sarnia-Lambton has reported 347 cases. Michigan now has 127,516 cases, with 14,520 cases being in Detroit. Today, we are reporting a total of 2,674 cases of COVID-19 since March, an increase of 1 case from yesterday. The new case is a close contact of a confirmed case and is still being investigated. 2,560 cases are now resolved and 38 cases are active and being followed by our health unit. 2 people are in the hospital. Our community has lost a total of 76 people to COVID. 53 deaths have occurred among residents in long-term care and retirement homes. Symptoms of COVID-19 can range from mild to severe. Some common symptoms include fever, a new or worsening cough, a barking cough, chills, sore throat, shortness of breath, nausea, vomiting, and diarrhea. Testing is available by appointment at select pharmacies in Windsor with specific criteria for people without symptoms. Please contact Shoppers Drug Mart Pharmacy for further information. Testing is also available by appointment only at the assessment centres in Windsor-Essex. Testing at assessment centres is for those with at least 1 symptom of COVID, high-risk contacts as directed by public health, and workers or residents of a facility experiencing an outbreak as directed by public health. Windsor-Essex has 3 assessment and testing centres: St. Clair College Sportsplex, Windsor Regional Hospital Lett Campus. Residents can call Windsor Regional Hospital or book an appointment online. Erie Shores Healthcare in Leamington, and SOHAC in Windsor, where testing is available for First Nations, Métis, and Inuit people and their families. If you have symptoms and have been tested, you must stay home and remain isolated pending your test result. The health unit will call you if you have tested positive for COVID-19. Please continue to visit our website at reachu.org for further information. I will now turn it over to Dr. Wajid Ahmed, our Medical Officer of Health.
Good morning, and thank you for joining us. From the beginning of this pandemic, the Windsor-Essex County Health Unit is committed to provide up-to-date information and resources to the community to fight the COVID-19 pandemic. This began with our daily live updates, the first of its kind in Ontario, that we started with our first case of COVID-19 in our region in March. Our modest team of epidemiologists and communication team really stepped it up to ensure that we not only have timely data, and we are able to share it in a timely manner using many platforms that we didn't use before to keep our community apprised of all the information. Both Teresa Marantet, our CEO, and myself as the Medical Officer of Health stood in front of the community to make sure that we are standing with our community to help them navigate through a crisis when the world is anxious and very little is known about the virus, and to keep our community safe. We are the only health unit that has continued to commit to this type of communication even after 7 months of this pandemic, and we have continued despite the pressure and considerable workload for our health unit. We heard both sides of the argument. We heard that sharing this information leads to more panic and anxiety, but we also heard having this information helps people to make good decisions for themselves. From a public health perspective, information sharing is critical. And we not only shared information, but we also made sure that public can understand what this information means and how they can use this information. We provided weekly epidemiological summary throughout the pandemic to round up all the data elements that we use in our decision making. Our team also responds to hundreds of questions via email, phone, and social media on a daily basis, and our local statistics continues to be updated 7 days a week on our website at 9:30 during the weekdays and 10:30 on the weekends. This information includes total cases to date, number of deaths, resolved cases, current outbreak, cases by sex exposure, type of cases, and age. As you can imagine, all the efforts was not something that public health was prepared to do given the resources and the expectation and the role as laid out in the legislation. But every public health department stepped it up to the critical part of crisis communication, and that communication continued to happen throughout the province of Ontario to help the community and communicate live throughout this crisis. Our communication team, our epidemiologists, our public health nurses, our public health inspectors, our clerks, our management team work day and night to ensure that we do not leave the community in dark, and not only keep the community safe with our case contact management, outbreak management, but also to keep the community informed about everything. Our epidemiologists, who are also working diligently every day to investigate our cases for outbreaks investigation, they also provide weekly summary breakdown of our data on confirmed COVID-19 cases overall over the past 30 days and over the last 7 days. This information is helpful to give a sense of trends to inform planning of our community. We also break down our cases in summary by municipality. The full summary is posted every week on our website that is available for the general public to review. Our case counts and statistics webpage had over 500,000 or 500,000 visits in June alone, and then continue to increase every month. Our communication department and epidemiologists answered questions daily regarding clarification or interpretation of our data and information locally. We continue to commit to providing up-to-date information. We do provide information comparable to majority of our health unit colleagues and exceed many, despite having one of the highest rates of COVID-19 in the province, and despite being one of the lowest funded on resource and low resource health units on a per capita basis. In the same efforts, our epidemiologists and communication team work together to create this new tool that our community can now use to understand the COVID-19 data in our region in a much better way. The new tool uses a business analytics service by Microsoft called Power BI, and will have an interface that is simple enough for community to visualize data the way they want. This new edition can be accessed on our website at www.wchu.org/cv/local-updates. Please note that this tool will be refreshed daily at noon every day, only on weekdays, and on the weekend we will continue to update our case count. I'll give a quick tour of this website right now. So if you go down to our main web page and click on daily updates, it will bring you to this local data. And if you scroll down, you can come to this tool, which will show you the epi cases throughout the pandemic. This is the same epi curve that I use every week in my epi summary. One way to play it is to look at the data by choosing the date when you want this data to be seen. So for example, if you just want to see what happened starting the month of May or starting the month of June, the data will adapt to it and will show you from that timeline. And if you want to change it halfway up to almost mid of June, July, you can do that. If you want to see what happened in the last month, you can see that. And that way you can even just control it from the end date as well. Where do you want to see it? And the data is further differentiated with respect to active cases, as well as for the all cases in the region. And if you want to see by each of the municipality, whether one of the municipality is so this right now it's selected for all municipality. If you want to change that, and if you just want to see what is happening, let's say in LaSalle, this is what it would look like right from the beginning of this pandemic. This is what the data would show. And then if you want to add Essex, if you want to add select all, you can see all of that. And then in the bottom, this will show you the distribution by gender with respect to males, females, and then cases by age. It can be seen here as well. So it has 2 pages, so this is the first page. Second page, if you move, this will give you a breakdown of what is happening with respect to the active cases currently that is in our community overall, and then cases by municipality by each municipality by rate. And then same idea, you can look at the active cases, you can look at all, and you can look at a specific date range. So this particular one can give you a breakdown of what is happening. So if, let's say, if we want to see what happened in the last couple of months, we can see with the case counts, it will be updated and it will show you. So the data is continue to be refreshed. We will continue to add more information on this website, and we'll continue to keep the community updated with what to expect as we add more and more data elements. So this website will be live. The data that was last refreshed on this website was September 30th, but we are committed to refresh this data at noon every day. So this data, what you're looking at right now is up to September 30th. And then today at noon, the data will include all the data up until yesterday, and then we'll continue to populate that every day, and except the weekend. And weekend, we will continue to report the number. We hope that with this new tool, the community can now have a better understanding of the visualization of data. They can break it down data the way they want to see, and it will provide them with the information that they're looking for. And I'll stop here, and then I'll take more questions. Thank you.
The conference is now unmuted.
We'll now take questions from the media. We'll start with CBC.
Nothing this morning, thank you.
AM 800.
Dr. Ahmed, just going back to Friday when the Premier announced put a pause on social circles, I guess it seems like there's a lot of confusion out there because if I'm not mistaken, he said stay within your household, people within your household, but anyone can go to a restaurant, sit with different people, then go to the gym, work out, then go to the rinks, play hockey. Just seems like there's a lot of confusion. Are you hearing that since Friday?
I do, but honestly, Rob, I don't think that there should be any confusion because there's a clearly difference. When you're talking about the social bubble, you're talking about the social circle, those are the people that you're inviting in your home, inviting in your personal space, and maybe the concept of social bubble as described by the Premier and by the promise, it allows to not to follow that physical distancing measure. So they can come together, they can hug each other, they can sit together. So all of that can be done. When we're talking about the restaurants, when we're talking about going to the gym, that is not the same. You are to maintain all those physical distancing, and you are not meeting people that are invading your personal space. You're not meeting people, you're not sitting down with them, you're not sharing a house with them. So there is a difference. You can say, you can argue that, yeah, you are meeting, you're not really connecting with them. You're just being in the same spot with many people. And the recommendation still is, you're not supposed to interact with them as unless you don't have to. You go to your gym, like many people do, they don't talk to anyone, they just go, they just do their part and they come back. When it comes to restaurants and other places, again, when you're talking about bringing who's going there and who you are going along with, and again, the ability to physical distance with each other, and the possibility that maybe if they are not your household contacts, you are putting yourself at risk. So choosing who you're going along with is critical. I think it's a flexibility, it's an option that is given to them, because recognizing that we are all different. Half of the people, if you recommend don't do anything, they will gladly do it, and they will say, yes, that's what we want to do. We don't want to meet anyone because it's dangerous, it's risky. And half of the people, you would say, well, I cannot, like if I am a single person, if I just live in my own house, I need to see people, I need to connect with them. So I think just making that distinction is very critical. And when we're talking about removing that concept of social bubble, which is when you're allowing people who are not your part of your household to come close to you, to not to follow any of the public health guidelines. So that recommendation is gone. You should try and follow public health guidelines with everyone that is not part of your household.
Going back to Friday as well, with his comments in regards to the assessment centers, are you and your team worried that this could maybe either increase testing at the assessment centers or decrease? Maybe people don't want to make that appointment, go online, and maybe think it's a hassle compared to going there. Do you think it could go either way, the numbers?
I would think, and again, I will let Teresa comment as well, but I would think that it would make things much more easier for people, because now, like as we have heard comments, that people don't want to wait in line. So it would be easier for them to know that, I can book an appointment and I can just go straight in. I don't have to wait in line. I don't have to potentially expose myself or to expose others while I'm waiting to get that testing done. It does require a lot of logistics and effort on on the back end from the assessment center part. And I'm really happy to report that what we have heard from our hospital is they immediately set that system up. We've heard some real concerns from other parts of the province where the assessment centers are not ready to offer this appointment-based testing, and they may need at least a week to get up and running. But our hospital, Windsor Regional Hospital, really stepped it up. They had this system in place, and they can take on everyone who's coming in for the appointment. So I think our community, as we have said, I think our community has gone through a lot, and our community is much better prepared than many of the other community. And this is an added value to our residents in the community, that they can now book that appointment, they can go straight in and get the test done in a timely manner. And hopefully when the backlog is cleared, we can get that information back very quickly for our case and contact management, and it should be a win-win for our community.
Okay, thank you. I have a couple more, but I'll ask them in the second round.
Any questions from the Windsor Star?
Rob has asked them all. Thank you.
Okay. Any questions from Blackburn?
Just in regards to the backlog, I know you don't know exactly how many tests. Is there an estimate on how many tests are pending locally?
No, we don't get that breakdown locally. I think the province does provide that detail. What we have seen is we presented our data, so that right now there's like roughly 80,000 tests that are pending province-wide. When we report, if you recall, on Friday, I do report how many tests we are getting in a day, like within 24 hours, and how many proportion of tests we are receiving in 48 hours. So that information we get, but we don't get that daily information that how many of these test results are pending.
Okay, thank you. And just from one of my colleagues, she wanted to know, did the feds restore funding for the migrant farm worker isolation center?
Yes, that is correct. And the city was working with the all levels of government. Public health was supporting all that application throughout the process. We provided our recommendation both to the province as well as to the feds to continue the funding, and I think the mayor already reported it. We're very happy to see that all of that work resulted in the restoration of the funding support. It is really important for our region. Our region has the highest number of temporary foreign workers, and what we have seen very quickly, that how 1 or 2 cases can lead to up to 20, 30, and sometimes even 40 cases that require self-isolation. And without having the ability to self-isolate properly, our community is at risk of spreading it not only within the farm, but also in the community. So I'm glad that this system is now in place. It has worked well in the past, and we're hoping that the funding will be ongoing rather than just stopping and reviewing it. But again, nobody has seen what the future would hold for us. So before the time ends, we should be able to extend it, or the feds should be able to extend it to ensure the continuity of services for these communities. So this is really a good news for the community.
And how long is that agreement in effect for? Is there a time limit on it, or it's just kind of ever ending right now?
Sorry, can you repeat your question again?
How long is the agreement in effect for? Is there an end date in sight?
So right now, it would, they plan to extend it by every 30 days. And the idea behind is, they don't want to pay for services which no one will use. So making sure that, we have the most up-to-date data that we can use to predict for what's to come in the next 30 days or next 45 days, and then can provide that information to the feds to continue the funding. And that way we are hoping that there shouldn't be any breakage in the service, but right now it's based on every 30 days that they plan to extend.
And how many are isolating there right now?
So right now there is none. There are some cases, but those farm owners are using their own hotel to isolate those individuals. But again, the coordination piece is critical. Now we have that site up and running, so we should be able to direct the farm owners, operators to those sites to provide the self-isolation services with everything else that we were providing before.
Any questions from CTV?
Yes, good morning, Dr. Ahmed. Good morning, Teresa. I guess I apologize that we're talking about it a week in advance, but I heard you talking on Mike and Lisa this morning about Thanksgiving. So just for the record, what is your recommendation for folks and residents in our area, in our region, for Thanksgiving, the weekend?
First of all, Bob, because you missed last week, so that's why I think Mike put you at the last to ask this question. I'm just kidding. We missed you too.
Of course.
So for Thanksgiving, yes, I think it's a time for families to come together and to share the meal and share the blessings. I think it's a very important time for many in the province. But we also have to recognize that what's happening with COVID and not only in our region but everywhere else. Some areas are really hurt hard, such as Toronto, Ottawa, Peel, and surrounding areas. I think they're seeing a surge in the number of cases. For our region, we were lucky not to see the same numbers, but again, we have seen that can change very quickly. So for our region, our community, I think what we will always say is, follow the public health guidelines as you are told. Not have any of those big gatherings because again, that's restricted at this time. If you have family, friends that you want to share the meal, try and share it virtually. If you are alone, if you don't have any close family members living with you, I think there is some flexibility that the Premier has already mentioned that you can maybe try to support them. And as a community as well, if you have a neighbor who's alone, if you have a relative who lives alone, who's looking for that support at this critical time, I think it's important that we do not miss them. We continue to provide that support to them. And this is what our initial message was in the beginning of this pandemic as well, that we wanted people to make sure that you are trying to restrict the number of people that you're meeting and not meeting people who are outside of your household. And then even then, not forgetting the people who live alone or who may be at a higher risk of either developing any medical complications or developing any mental health challenges. So I think it's a critical time. I want people to enjoy Thanksgiving, but in a way which do not put anyone at risk. Follow the public health guidelines. Try to stick and follow celebrate Thanksgiving with the people that you live in. And if you are alone, you can pair up with people who are in a safer manner without putting anyone at risk.
But I guess sensibility here, right? Because everybody's talking about social bubbles and family bubbles, and everybody's got a bubble, right? So 3 or 4 bubbles or whatever. So in order for that bubble not to burst, I guess we should be a little sensible heading into this weekend then, right?
Yeah, I think it's more empowering, I would say, because again, as I said, that sometimes some people would want that, and the power is in their hands right now. There is nothing in the law to say that you cannot, but I think what they need to be understanding is what is at risk. And even if I have a grandmother or a mother who's old, who is sick, and who could be at a risk of developing more severe complications with COVID, I should be responsible of not to meet with them. But if on the same hand, if it's just me and I'm young and healthy and I live alone, but I want to have my Thanksgiving with someone who is of the same age and who may not be at a risk, and if I am keeping myself very carefully, not coming in contact with the rest of the community, and the same thing the other person is doing, yeah, you can come together, you can share that. So I think it's just the flexibility is important. And again, if people want to criticize, yeah, they can criticize, doesn't matter what you do. But I see that that's the opportunity for people to make the right choice, to do the right thing, to keep everyone safe.
Great, thank you, sir, appreciate it.
Any further questions from CBC?
No, thank you.
AMA 100?
Teresa, the travel-related cases that we're seeing lately, are any of those related?
The travel cases have not been related, but they have been basically international travel outside of Canada and the US.
Okay, thank you. And then Dr. Ahmed, going off of Bob's question about Thanksgiving, I know most post-secondary education students, it's all mostly online. But for those that are going back home or coming back to Windsor, I guess your message to them, because this is not a time for them to go out and party and have a couple drinks. This is a time, obviously, like you mentioned to Bob, spend time with family, stay within your household. I guess just your message to those students that are coming to Windsor or going back to their home city.
Yeah, so I think what I would say is an advice similar to, let's say, someone who works, who lives here in Windsor and go to Michigan for work. So I would see that something similar. So if you are a student living in Windsor right now and you have to visit your parents, let's say in Toronto or in Ottawa, and if you are traveling, you just travel. So obviously the recommendation is if you can avoid that travel, please do. But let's say if you choose to go to that, to meet your parent, you go immediately, you go home, you have your dinner, you stay home, and then you come back immediately as soon as possible without doing anything else on the side. So I think that's the critical piece that people need to recognize. And even the same thing, if someone is coming from somewhere else to Windsor, come do your Thanksgiving dinner, stay with your family, and then go back immediately. Don't do anything else. I think that's way we can avoid any potential exposure, potential transmission, even if there's a case. And as I said, people can make that decision whether what they want to do with themselves. But for the community, it is really, really important that they follow this, not to put anyone at risk.
Thank you.
Any further questions from the Windsor Star?
No, thank you.
Blackburn?
No, thank you.
CTV?
No, I'm good, thank you.
All right,
Thank you,
thank
everyone.
you.